Last night, the Health Ministry reported 32 new COVID-19 cases among staff at the 8 bus interchanges, putting the total number at 469.
A quick look at the breakdown of cases for each bus interchange. Toa Payoh bus interchange now has the most number of cases at 150.
Followed by Boon Lay with 113, then quite a drop to Clementi, which has 39 cases. Sengkang with the least number of cases at 27.
Infectious diseases specialist Dr. Leong Hoe Nam from the Rophi Clinic is here now. Welcome to the show, Doctor. As we just outlined, over 400 cases have been linked to bus interchanges and probably more will be reported later tonight. How safe is it for us to ride on public buses?
I think it is still very, very safe. Now, I'm going to put a little caveat here. Minister of Transport, Mr. Iswaran, has said that he doesn't think, and there's no evidence of infection to the public at the interchanges. But absence of evidence is not evidence of absence. So I am still very fearful for the public when they actually have to commute. Now, the context is this. Sydney has said 10 to 15 seconds is all you need for the virus to transmit across. So for those people who are using the public transport, and that's really the large majority of Singaporeans, there's you and me out there, we have to be very careful about the buses. We want to do our part for Singapore. We want to minimize the transmission. So what I would do is I would make sure my mask is well covered, covering the nose as well as the chin, and even wear double layer masks, especially with the reusable mask on the outside, with the single-use mask on the inside, the ones that have been certified. And number 3, if I can, I even do a tie behind to make sure that the side gaps here are closed. This way, only filtered air goes in. Remember, keep your conversations short. Better still, no talking on the bus, on the train. This way, you're going to protect the people around you. Now, we need to look after ourselves in order for Singapore to be strong. So I encourage everyone to not talk. Thank you for that great, relevant question.
Well, great advice there, Doc. So, Singapore's Director of Medical Services, Kenneth Mark, he expects the cases in the bus interchanges clusters to fall from this week. This is something that he said on Friday. What's your assessment?
I would totally agree. That's because when you tighten the measures, the chance of transmission will come down. And of course, when the ministry comes down and look at the interchange, the rod will come down at the same time. And in turn, everyone will get in line. Everyone will make sure the mask is done properly. There's no more slipshod or lackadaisical attitude in terms of safe distancing as well as wearing the mask. When that happens, the interchanges will turn safe and the transmission will come to an end.
Right, so let's talk about something else, Dr. Leong. From this Thursday night, all inbound travellers from Category 2, 3 and 4 countries will need to produce a negative PCR test result taken within 48 hours before leaving for Singapore.
Compared with the previous requirement, the pre-departure test window has shrunk by 24 hours and now applies to Category 2 countries as well. So, Doctor, these border control updates are happening rather frequently, which can be confusing for those looking to travel here. Should Singapore keep reacting and adjusting our border measures? And how does it fit into our roadmap and strategy to becoming COVID resilient?
I totally agree with you. The changes happen so often, I have trouble keeping track with it. In fact, when someone asked me about it, I have to go online and check on the immediate measures before I actually answer the question. So yes, you're right. It makes it very, very difficult. And if you want to open up the country when you have so many rules, it makes it really difficult. And the granularity of it, I mean, who can actually remember these figures? I'm very sure even that some of the officials themselves will be struggling. That was yesterday, that was last week, what of today, or even tomorrow? In fact, what is relevant today may not be relevant 2 days or even next week. Okay, but at the same time, you want such granularity so as to allow as many people into Singapore as freely as possible, or you want to do it in such a way so as to provide as many relevant testing as possible and take away those which are irrelevant. And I mean, take 48 hours, for example. You realize that The incubation period of the virus is shortened, and this is a response to the shortened incubation virus. I guess Singapore, we just all have to get ready. In fact, again, the plea is to get vaccinated. Once you're vaccinated, Singapore opens up much quicker, much faster. So what if people come in with a positive PCR? If the entire Singapore is vaccinated, there will practically be no deaths. So get vaccinated and protect Singapore.
Right. Well, Dr. Leong, thank you as always for coming on the show. We appreciate your time and insights. We've been speaking with Dr. Leong Hoe Nam, an infectious diseases specialist from the Rophi Clinic at Mount Elizabeth Novena.